The following portion of 8 West is sponsored by Mentavi Health. If access to mental health care is a barrier, you don't have to live near a specialist or wait months to take the first step to improve your mental health. That's where Mentavi Health, our mental health expert, comes in. Today, we are talking with Mentavi's CEO, Keith Brophy, and Dr. Barry K. Herman, Mentavi's Chief Medical Officer. Gentlemen, welcome to 8 West.
Thank you for having us.
So, Keith, before we dig in, we're going to start with you. A lot of folks watching, they may not know exactly what Mentavi Health is, who you are, and what you do.
Mentavi Health has been around for a while now, about 8 years, and we started with a focus on ADHD and gradually expanded to a focus on general mental health, anxiety, depression, ADHD, and we provide an easy-to-start online journey to mental health diagnosis and treatment where warranted. We started right here in Grand Rapids, and we're in all 50 states now.
Oh, wow. That's quite the expansion. Okay, so Barry, this next one, we're going to bring you into the conversation as this one does hit close to home for a lot of people. What are we actually talking about today in clinical terms?
Well, in clinical terms, the same symptoms that people are experiencing can often come from several different conditions, and several of these conditions can present at the same time. For example, someone who says, I can't focus, I'm feeling overwhelmed, I'm falling behind in work, I can't get anything done. At first glance, this may sound like perhaps ADHD. But when you look more closely and carefully, that same person may be struggling with anxiety, depression, poor sleep, or even another condition. And sometimes several of these are occurring at the same time. And that's why simply identifying one symptom or using a simple single screener, it's just not enough. You have to look at the whole person in order to be able to tell what's going on.
So Barry, why do so many of these overlapping issues get missed so often?
It's easy to get derailed and focus on one symptom or a few symptoms and then kind of miss the big picture. And that's why you really have to deconstruct or really take apart somebody's symptomatology and look much more closely at what's going on underneath everything.
Can you give us a real-world sense of what this looks like?
Yeah, sure. I mean, somebody doesn't come for help saying, I have ADHD, and I have depression, and I have anxiety. They're much more likely to say something like, I can't concentrate, I'm exhausted, I worry about things all the time. My life isn't the way it used to be. And so our job is to really understand what's underneath all of that. And that's been our approach all along with our diagnostic evaluation.
And I think this next question is going to help answer a thing a lot of people think. Do you have to be in crisis or struggling at that precise moment in order to reach out?
Absolutely not. In fact, if you just have a sense that something isn't right, that something's going on, it's always better to find out what's going on earlier on. The earlier we can catch something that may be starting in terms of the beginning of some kind of a problem, the much better the outcome is, because we can intervene earlier, we can initiate treatment earlier, and we know that that leads to better outcomes.
Okay, and Keith, can you tell us a little bit about this model? Can people use this really from anywhere?
It's a really easy start. You can truly use it from anywhere. Our system is virtual, so wherever a person can get to the web, they can get to us. And then we offer a secure, private experience of a diagnostic process. Our diagnoses are comprehensive and reviewed by one of our Mentavi psychologists with an optional treatment path. But our whole model is based on making it easy to take that first step.
And I know that we always love announcements, and I hear you have an exciting announcement. What can we look for as Mentavi continues to evolve?
We do have an exciting announcement. We're known for our comprehensive approach to looking at comorbidities and the full person. For example, 70% of all those with ADHD, according to the CDC, have more than one mental health scenario like anxiety or depression. So our diagnostic approach has been comprehensive, but we're adding to it with a release to come this fall. It's going to become even more comprehensive. We are adding a screener for adult spectrum autism, and we're really excited that in recognition of the nation's mental health crisis, we're going to offer our mental health snapshot, a recurring screener, at no cost. So if somebody can make it to our site, they can take the snapshot to start their journey or take an even more comprehensive diagnosis evaluation.
If someone is watching and they're like, this is me, how or where do they get started?
That first step comes really easy. Just go to Mentavi.com. Our patients come to us sometimes referred by their primary care physicians, but they can also reach us directly at the website. And from there, they'll be able to create an account and start their journey.
All right, Keith, Dr. Herman, thank you so much for joining us today. Here on 8 West, we appreciate your time. And the preceding portion of 8 West is sponsored by Mentavi Health. We'll be right back with more 8 West, so don't go away.